So I'm going to be talking before I start actually a little bit about myself for those of you who don't know me. My name is Denis Donovan. Like Kevin told you, I'm down in West Palm Beach, Florida. I'm a physical therapist. I work in outpatient orthopedics. Actually a colleague of Joe who's going to be talking to us in a little bit. But yeah, I treat, a wide range of patients. I use the TECAR therapy with about 75 to 80% of my patients. Varying the intensities, the frequency to target different tissue depths, different phases of healing. But I do get a lot of really great use out of it. Work primarily with, well, I see a lot of golfers naturally, being that it is in Florida. So one of the things I want to talk about is one of the newer devices that Winbac's put out, the high tens, and how I use it for treating trigger points and tendinopathies. So I have a couple videos I'm going to share with you guys, but first I just want to talk to you a little bit about the interface, give you guys a little bit of an idea as to how the high tens unit works. So you do have a high RET menu as well as a high tens menu. Basically, the high ret is going to be the same high frequency current. 300 to 500 kilohertz that you'd see on the back three. What's unique about this specific device is that there is a high tens component as well. That high tens is going to mimic a low frequency current, but at a high frequency intensity. So basically, there's a pulsing of the high frequency current that allows it to give a stimulus to the user that feels similarly to a traditional tens. There's different frequencies of the high tens, 2 to 5 hertz, as well as 10 to 25 hertz. Now, the recommendations for that is for more chronic things, you're going to want to work at a lower amount of hertz, so in the 2 to 5 range. For more acute injuries, it is recommended that you're going to want to work in a 10 to 25 hertz range. And that's going to impact more of the gait control theory, help for people that are in a little bit more pain. As we get into the videos, I'll talk to you guys about how I've toggled this with different users and how I've gotten relief for people, even though their issue might be a little bit more chronic. So 2 different modes on the high tens unit. There's the swap mode, which alternates between high tens and high ret every 4 seconds. And that is adjustable, and that's going to be better for acute injuries. There's also the mixed mode, which alternates the high tens and the high ret at the same time. That's recommended better for more chronic or subacute issues. With that, you're going to get an enhanced diathermic effect. You'll get more collagen synthesis because of that enhanced thermal effect. The last mode is the shock mode. So this is going to correlate between to 100% of the high ret and 100% of the high 10. So this is going to be your biggest blast of current, and it's going to really deliver that local hyperthermia to help break down or bring blood flow to fibrotic tissue. We're going to increase tissue elasticity, increase collagen synthesis, and it is recommended because it is such a high amount of current to alter this in between manual techniques. These for this device, the treatment times are designed to be about 5 minutes long. So and I have 2 videos I'd like to share with you guys. So I'm gonna share now. So the first video I'm gonna share with you guys is a soccer player I was working with. And we were treating him for an adductor strain. Can you guys see my screen still?
Yeah, you're there.
And can you see the video of me with the device on the knee? Is that what we're looking at?
Yes. Yeah.
Perfect. Okay, awesome. So, just a quick little backstory. This is a 18-year-old soccer player. We were treating him for an adductor strain, and as we got into later phases of rehab, just having a lot of issues with like a nagging patella injury. It had been bothering him on and off for the last couple of months. So when we started doing more dynamic stuff to challenge the hip and the lumbopelvic area, he was complaining that this was a little bit of a nagging issue. So I worked with him because, again, this was more of a chronic issue in the shock mode. So I'm going to play that for you guys now. Oh, Sorry about the music in the background, but let me rewind here. So you can see the shock mode. We're working here. Again, it's a 4-second click. I'm kind of moving the device around, getting both sides of the patella. I'm using the ground over the same anterior aspect of the knee. And that's because I really want that current to stay superficial. If I was looking to target something a little deeper, I'd probably position the ground plate on the posterior aspect of the lower extremity. But because I wanted that current really concentrating in the patella tendon, that anterior compartment of the knee, I kept the ground on the anterior aspect. If anybody has questions about that, I'm happy to elaborate on that more. Because that's something as a newer user, I think I was missing. And let me show you guys the other video I have here. So I'll stop that share. And so this is a woman who I had been seeing for a whiplash related injury. Oops. And I have 2 videos here. So this is me. I'm working through the upper trap. I'm alternating it kind of with my manuals. A lot of tightness in the scalenes, a lot of tightness in the upper trap, SCM, levator, everything on the right side was pretty jacked up. And this has been something she'd been dealing with for quite some time. So here you see I'm working at a 10 hertz for the high tens. I have the high ret set to toggle between 33, 66, and 100% heat. And that's going to rotate, every 8 seconds. So by the time it gets to 100, it does get pretty warm. And that's why I'll play the video again real quick. You'll see like after a couple seconds, I'm alternating with some manual. This was, just done for kind of the purpose of the video here. I was doing other stuff with her, a little bit of like contract relax stuff in a supine position. I have one more video of working with her. So this is, you might have a little better view. So here, you guys can kind of see the parameters a little bit better. I am working in the mixed mode because, again, that's going to be better for chronic. That's the one that's going to alter the waveform more concurrently at a frequency of 10 hertz. Again, better for more chronic issues. And what she was feeling was a very deep, gentle warmth, as well as a little bit of a tens-ish kind of sensation along that right side. What we found was that range of motion improved, pretty substantially after a couple treatments. And what I wanted to point out, though, is even though this was a chronic issue, she did respond better to initially a higher amplitude of high 10. So we had started at the 25. We had done that for a couple sessions. And then eventually I had dropped it down. And when I felt like she had plateaued there, and she did get better results once we dropped the hertz down to a setting that was a little better for chronic stuff. But this was how I started working between 10, 15, and 25. So stop my share. And